All right. Well, I think we will go ahead and get going. I know that we expect some more folks to join, but really want to honor your time and being on time. So uh, thanks again, and welcome to our Clinical Edge series. And our goal for this series is to discuss timely topics and to help you build your skills and knowledge and offer tools that you can incorporate hopefully into your daily activities. So today's presentation, as it says up on the screen, is Resetting Your Internal Compass, Wellness in the Face of Uncertainty, Part 2. So we did the first part of this series a few weeks back. And this is to continue to focus on strategies that really help you sustain your wellness. And our intention is to create a space in your busy days and engage in some really quite simple activities to provide you with additional tools to help you cope with really the uncertainty today that we're all facing. And our hope is in creating the space that we can really create an opening both for inspiration, but then also just to give you a brief respite from your very busy day. So let's take together, let's just take a look at wellness and take a wellness break together today and explore what healthy work-life balance looks like for you. And we're going to, in this specific part of the series, we're going to help you identify your core values and how you're recognizing the early signs and symptoms that maybe you're not in alignment with your core values. And in addition to that, we're going to be looking at, again, recognizing those early signs and symptoms that might inform you that things might be out of alignment for you. And in regard to that, really defining your personal boundaries and strategizing ways to effectively set and communicate these boundaries. Would you like to add anything, Cindy?
No, I guess just that I want to say welcome back to folks,
Definitely.
and hopefully you were able to participate in our last webinar, and I'm really looking forward to this new one.
Definitely. So we'll just briefly introduce ourselves. So again, my name is Chad Morris, and I direct the Behavioral Health and Wellness Program. So we're part of the Department of Psychiatry at the University of Colorado School of Medicine on the Anschutz campus. And the Behavioral Health and Wellness Program is a whole health, it's a national whole health program. So we have operated across about 42 states. And really the core of what we do is to help people lead the most meaningful lives, the most integrated lives possible, even in the face of competing demands that you all face and all potentially new stressors, with, of course, the current pandemic being one of those. And really looking at this both for providers, for other professionals, for patients, and communities as well. And this can be, even working on wellness in the face of individuals that have illnesses or chronic illnesses, because there's still a lot of wellness work that anyone can do.
Great. And I'm Cindy Morris, and I'm the clinical director at BHWP. And as we said last time, and you likely know now, is that we're married and we're sheltering together.
Sheltering together.
And
we're no mask right now.
And we're happy to welcome you to this webinar. And one thing I do want to say about our conversation today, we'll be moving through a few different activities, helping you to think through some things. And we would like to be able to hear from you all. We want as much as we can to be able to engage with you and have a conversation about these wellness topics. So please feel free to use the chat function throughout. We'll be monitoring it, and we'll be like to engage with you through that. Okay. And as as Chad mentioned, we're going to be talking about resetting your compass. And today we want to build on what we talked about last time. Hopefully, if you did join us for that one, you've had some good success in being able to pay attention to your emotions, practice some mindfulness, and really observe the signs and symptoms that tell you that you're reaching your limit and that you need a break. And as you notice, you know, what's been coming up for you, and as you've been practicing this, hopefully it's really helped you to be able to be aware and then be able to intervene, make the choice to do something differently, and practice new healthy habits that you really want to incorporate into your everyday, and especially healthy habits that really nourish your whole being. And as you are well aware, this awareness that you're practicing and engaging in will be really key to continuing to improve your wellness, and it'll be core to what we're talking about today. And so we'd like to begin by engaging in a centering activity by doing some deep breathing. So Chad, get ready to
Okay, I'm ready.
do a little breathing.
Mhm.
So I'd like you to shift your body into a comfortable seated position and really be aware of any feelings of tension you might be holding. Be able to drop your shoulders if they're raised. Release your jaw. Relax your muscles throughout your body. And you want to place one hand on your chest and the other on your stomach. And as you take slow, deep breaths in through your nose, pay attention to whether your stomach or chest raises first. If your breathing is shallow, you may feel only your chest lifting. Focus on taking a deep breath that lifts both your stomach and then your chest. And once you're able to take a full and complete breath in this way, practice taking several long, slow, deep breaths. Inhale gently through your nose, and when your lungs are full, hold your breath for 3 seconds. And then exhale by blowing the air out through your mouth. And as you take each breath, focus your attention on the sound and experience in your body. And envision any tensions of the day just easing gently away with each exhale. Okay, good job. All right.
All right, so first we're going to spend a little time talking about values and really helping you identify your values and really look at how we're going to incorporate those into your daily lives. And we all hold values. They're a core part of who we are, whether it's consciously or unconsciously. We all have these values. So we're really just trying to bring these values into conscious awareness so that we can work with them on a daily basis. And the values guide us in determining how we're setting our priorities, how we're setting our daily decisions. And they're really informing our choices and actions on a daily basis. And when we live in a manner that's really true to our values, we have a sense of meaning and an internal sense of congruence of who we really are, and really really a feeling of peace with ourselves. When we live in a way that's really out of alignment with our core values, that's when we really start to feel that internal conflict. And that can lead to a lot of things. So, for instance, that can lead to decreased motivation. It can lead to perseveration. It can lead to passiveness, procrastination. Um, you might feel a loss of purpose in your life, or feel anxiety. You might feel burnt out or exhausted. So those are a variety of things, and not, definitely not the only things on the list that you might personally feel. And we're going to get into that a little bit. So as you become increasingly aware and you're prioritizing your values, it's really going to help you direct how you spend your time and resources, which are really precious, specifically with everything going on today in our lives. It will also support you to make just the best decisions in your life. When you know what's most important to you, really the best steps for you become illuminated as you move along. And finally, any tension you may experience in situations that involve conflict can be eased when you are supported by the certainty that you personally have in your values, and, and really being true to yourself in that regard. So many of our values are consistent across our lifetime. It's interesting that if you do this exercise across your life, you'll probably find that maybe one or two of your core values stick around. Um, but our top values can really change over time depending on where we're at in our personal life, in our careers. Uh, do we have families? So, for instance, someone just starting, say, medical school is probably going to have different values than someone that's far along in their career, or they have a family, or are in a committed relationship across time. Therefore, it's just really important to reassess on a regular basis what your values are, so that you can be aware of those shifts and changes as life moves along. And did you just give me kind of one example of that? Carl Jung, who many of you know, very prominent psychiatric figure, really said that for a lot of us, that, for instance, we really don't become spiritual beings until midway through our lives, and so that value tends to increase over time. So whether you agree or disagree with Carl Jung, it's just that notion that probably in different parts of our life we're looking at different values. So it's definitely not static. It's a very dynamic type of thing that we're dealing with as humans. So what we'd like to do is really engage you, and given this, is really take a moment for you to consider what your values are, what your top values are. So what we'd like you to do is just scan this list and think about the values that are most important to you. What are the values that are central in your life? And what we'd like you to do is choose your top three values from this list. If you think of a value that's not on this list, that's perfectly fine. Just add that to it. And if you have pad and paper and want to write these down, that's wonderful. And so as you identify those top values, what we'd ask you to do, if you're comfortable with that, is just in the chat function, if you can share out a few of what those values are. And so we'll give you a few minutes to kind of look at this and look through the list, and see if you can just kind of shout out through the chat function what some of those are for you. Yeah.
So we've got one of achievement,
Uh-huh. Thank you for sharing.
justice, health, achievement, creativity, self
Self-knowledge.
knowledge, honesty, family, hope, loving, family, health, authenticity, growth, helpfulness, knowledge, purpose. Ted, which ones were yours?
Well, I'm going to get into that a
Okay.
little bit in a second.
So
Yeah.
mine are autonomy, authenticity, and joy, spirituality, growth. We have all a lot of
Yeah.
similar values.
Similar values, but quite a
Mhm.
range as well. It's really pointing to how unique we really are in these values. So thanks for those who are putting up some of these. So purpose and family, another person sharing.
Integrity.
Integrity,
Mhm.
is a big one. Well, as you think about these top values, consider the following questions. We're just going to give you just a little time to consider these. So we'll pause between each of these questions so that you can give a little thought to them. But the first one is just what makes these specific values important to you. So why are you choosing these specific values? And again, feel free to, if you want to share through the chat function, that's great. But we'll ask a few of these along the way too. So what makes these important to you? And
We
then,
had a hand raise.
hmm?
We have a hand raise.
Oh, okay. So we have a hand raise. We'll see if we can look at that.
How do we do that?
And maybe one of our colleagues, Jim, is on as well. So Jim, if you can see some of the hand raised function or whatnot, just kind of chime in and let us know who that is. Maybe we can unmute them.
Well, either that hand has been lowered or I'm not able to see it for some
Okay.
reason.
Well, I know if you're anything like me, I've inadvertently raised my hands on almost every webinar that I've been involved in. So, but
So we have one person who shared that these values are the ones that, in particular, they need to find balance in.
It's great.
And
For meaning in life is another
yeah.
comment. So the next question is, how do you see these values reflected in your everyday life? So just spend a minute or so thinking about that. And I think you can ask both. I can ask both these questions at the same time. So now, not only how are you seeing these values reflected in your everyday life, but are there ways that you aren't living in alignment with these top values? So where is it obvious that you're living by your values, and where is it obvious that maybe that's not happening right now? Okay. And the last question in this series is, if you are out of alignment with your top values, how can you better integrate your values into your daily life, your daily decisions, choices, actions? And this is where we'd really like to, if a few of you again are willing to chat in, we can just kind of share your basic ideas with everyone else. We'd love to hear from you in chat.
So we have someone who adds that COVID and politics really distract and cause some internal upheaval.
Yeah, I would
Mhm,
assume that the majority of us are right on board with that.
mhm, yeah. And what I was going to say, do you mind if I share what I
No,
was
please do.
thinking about? So one of the things for me is that, with COVID, we've been working from home rather than going into the office, which actually is in alignment with my values. And so I'm really enjoying that um, time not commuting and things like that. So I have more freedom to do the things I really enjoy. Um, However, it also means I don't get to travel, and so that's something that I feel the discomfort around. And then, when because I don't have as much freedom in my movement in that way, I notice I can get into like routines that sometimes can feel confining. And so being able to break out of that routine and create space is something that
Hmm.
is important for me to focus on and think about
Hmm.
doing.
Hmm.
And
It's almost with like this pandemic, we're all learning new habits and and
mhm,
some of those they're good and healthy, and others aren't so healthy personally. And so trying to determine that across the last 3 months has been really interesting.
yeah, and we have somebody in the chat mentioning too that how working from home makes it harder to align,
Hmm.
right? Because in I think work and home is so
Hmm.
close that it's really hard to separate.
Yeah,
Hmm.
definitely. And I know with the participant that shared that COVID and politics are distracting and causing internal upheaval. Are there ways that you found to kind of counter that and get back to your you know better integration of your values? You'd be very interested in that as well.
And then the balancing the work from home and how do you handle being so close to
Yeah,
home and
yeah,
family and being able to have space for yourself.
yeah.
Hmm.
Well, and I know we are considered non-essential personnel. We're at home. I don't really like the term non-essential personnel. That
We're
well, it's kind of,
essential for sure.
we're essential in many ways, but this also for the essential personnel, they're dealing with a whole other realm of issues, and hopefully some of you are joining us today as well. But yeah, it's just a brand new world with the issues that you're facing as well. Okay, well, here's someone else.
So it sounds like you need to look for some more strategies of how to balance the politics and
Right,
COVID and
right.
maybe staying away from Facebook and other social media, not watching the
Right.
news.
Well, I can tell you personally, I find it incredibly addictive, the media overload, and trying to stay away from
Mhm,
that on the web and not checking in
mhm.
multiple times a day.
Yeah,
For me, it's personally very difficult, but it's something I'm trying to practice.
because like, they're saying here is, you want to be aware
Hmm.
as well as not become
Hmm.
too drawn in or
That's right.
distracted by that.
Hmm. So the good news with all these questions is that when you do not see your values reflected in your life and you're feeling that discomfort of that misalignment, I mean it's difficult to tolerate, and you're going to experience the consequences of that over time. And so it's really just building, again, the basis of everything we're talking about is awareness. So what we want to talk a little bit about are just what are those signs and symptoms that tell you that something isn't right, and in regard to alignment with your personal values. So.
Mhm.
So we want to ask, what are the signs and symptoms you are experiencing that tell you that you're living in a way that might be out of alignment with your values? And what are these things, some of the things that you experience? So I would like to just kind of share my personal example just to kind of kick this off. And,
Mhm.
if you want to speak to anything as well, Cindy, but, when I looked at the values exercise in that matrix, really the ones that popped up for me are creativity, freedom, and service. So those would be my top values. But I've been really feeling some value incongruity following the pandemic. And really, this comes from the fact that as a psychologist, I'm being called to volunteer for a wide variety of things. So every week it seems like there's another kind of call to volunteer for this or that on the counseling side, like direct service or other things. And it seems like, it might not even state it, but it almost seems like it's an expectation that you be involved with this. And so based on my values, one of them being service, and that is a strong incentive for me. And so I do feel pressure to participate in these things, particularly in the face of a pandemic when there's just so many people in need. And I know that I might be able to help in some regard. But that really is at loggerheads with my other values, which are creativity and freedom. So, this pressure, I almost kind of fight against this pressure to engage in specific activities because I feel like it's really not allowing me the freedom and creativity to really determine what my best contributions are for maintaining a life work balance, but what are the best contributions I can put out there for my community, for patients, etc. And so that's kind of what I've been really struggling with quite a bit. And so some of what I feel, some of the signs and symptoms that I feel are some level of guilt. I feel some irritability when I keep, the next ask comes up, which asking me to be involved in something or another. And where I feel that, so the psychological part, but from a physical standpoint, I really feel that is like tension in my neck and shoulders. That's like really a sign for me. And it's really that pressure kind of bearing down on all the expectations that I feel like are being put on me in some regard. So that's kind of one example of how this is playing out for me personally. I
Mhm.
don't know if
Yeah.
you want to.
Well, and we've had some people share saying that their signs and symptoms are anxiety or self-doubt, procrastination, especially working from home. And I certainly have that too. I'm expert procrastination procrastinator. I can end up doing everything else
Right.
and what I need to do if it's something that's incongruent with um, something one of my core values. And then we also had a question from someone that was asking, if you are not living in alignment with your core values, is it typical to experience anxiety?
I think it's very typical. hmm Yeah. So
Mhm.
some level of anxiety. And there's probably something under if you kind of sit with that and
Mhm.
try to kind of go a little deeper into what's sitting under that anxiety. I think that's useful as well.
Yeah,
Mhm.
because it's that incongruence. It's like we can feel it emotionally and in our bodies. There's that tension that I think that comes up for a lot of people, whether
Mhm.
physically or
And right
emotionally.
now, I think many of us, I'll put myself
Mhm.
in this category, is I think we're all somewhat feeling a greater generalized anxiety, and then
Mhm.
this is just kind of intensifying that or exacerbating that as well.
Mhm.
Mhm. Do you want to, for our other attendee?
Yeah, and we have someone else who's commenting that they find they have to put their health on the back burner sometimes, because it's hard to incorporate regular mindfulness, and putting forth the best version of yourself, and be an activist in the face of injustice.
Right.
And so you have those kind of competing things, and it comes at a cost of your health.
Mm-hmm.
And I think there, other folks are mentioning things like sleep issues, feeling helpless, in the job when working with people. You know, you can't, there's nothing we can fix. This is just, we
Mm-hmm.
have to just hold the space. And then a overwhelming sense of resentment and anger towards
Yeah.
the whole process of having to live through this
time.
pandemic.
Thanks for being so honest about that. And I think
Mhm.
that's true for a lot of us too. And, you know, I think one key is not trying to judge that at all, but
Mhm.
just sit with it and realize that is reality, that we're going to have some degree of that resentment and
Mhm.
anger.
Yeah, and I think, and I appreciate everyone sharing these signs and symptoms, especially these feelings that, we may have some judgment around, because if we don't give space to our emotions, if we don't express them, we don't process
Right.
them, then it gets stuck. I mean, it's
Yeah.
stuck inside of us, inside our bodies, and then, you know, we have more of a chance of acting out and
Well,
doing things that don't work for us.
definitely. And I think it's been instilled a lot of us in our educations that we really shouldn't be feeling this way. You know,
Yeah.
we're supposed to be helping professionals that shouldn't have anger, resentment, irritability, etc., depression
Hmm.
around these things.
Yeah,
And,
this has to be like, I've got it, you
yeah,
know, I'm the
yeah,
one who's supposed to be supporting other
right.
people.
So bottom line is, I guess we're human, and you know, we will be experiencing these things. Mm-hmm. Thank you all for sharing so much. This is really great. Well, so in looking at resetting your compass, you know, it's wonderful with so many of you know when you're living in a way that's not consistent with your values, and that's what you've been sharing with us. So that's great. Um, I know that I feel appreciation each time I become aware of a sign and symptom, because at least I have that awareness, and then I can choose what I do with that. And you know, I don't always choose to do the right thing, but at least I have that awareness.
Yeah,
that,
and you
I mean,
know your internal compass is working.
It's working. It's there, and then I have the ability to act or not act in a way that's going to be healthy for me. But now that the world has been so transformed, it's even more important to us to attend to these messages we receive from our internal compass, our internal guidance, and realize and notice these signs and symptoms, especially when they may be new ones that are novel to us, given all the new things going on in our lives. So it's important to really try to gain a practice of checking in more than once a day about what your body is feeling like, where you possibly holding tension, your anxiety, your emotions, thoughts, behaviors, and those are what are really going to tell you what you need and want. So we all just need to listen to ourselves and you know, try to treat ourselves with the same care and respect that we would treat you know our loved ones, as well as those that we're serving. So I think that's a good reminder, you know, and not get too hard on ourselves, and stop putting off our needs. Basically, we all know that unless we nourish ourselves, we're not going to have anything to give to other people. We're going to get burnt out and not be there, not be present, not be aware with our families and in our world of work. So once you're aware that there's something that your internal compass is telling you that you want and need, so how do you meet those needs? And often it takes setting boundaries, and so that's what Cindy's going to get into a little bit.
Okay. So, what do your boundaries look like? Maybe something like this. Are you good at aligning your um, boundaries with your values, like this rock wall? Are you clear and firm? Do you have limits that are well defined? Or maybe your boundaries might look more like this. I'm from California, so this is a very familiar thing, which is, you have the mist of marine layer that burns off once the sun rises up after the morning. And so I'd like you to think about, what do your boundaries look like? And these were things that I thought of, whether it's like a rock wall or a mist of marine layer. So you can choose one of those, or else what are other images or um, that are good representations of your style of being able to set boundaries? And if you could chat with us, that would be great.
Yeah.
I know on my side, I'm a little more mist than rock wall.
I'm a porous rock wall.
Okay, so some things can get through.
Maybe volcanic rock wall or something like that. But yeah, what do you visualize when you think of your boundaries? I'm not seeing anyone offering you. Oh, there's someone. Yeah, there we go. So here's
Okay.
some come.
Painted line on the road, easy to see, but also easy to cross. Wow, that's wonderful. I
Yeah,
love that.
I like that a lot.
Um, Trying to surrender to anxiety. And rock wall in certain settings when it comes to family and personal time, more like myths with work.
Yeah, that's very common
A wood fence, but sometimes the gate opens when it shouldn't.
too.
So wood fence with the gate, a line in the sand
They end up at the foot of the
of the
cross.
cross.
Huh. That's interesting.
Um,
I
so we have someone who recently built a rock wall, but other people may not be reacting so well to that.
And we're going to get into that a little later, in a few minutes, actually. So, yeah.
And it's also harder to set boundaries between work and family. Setting boundaries with work colleagues who don't have boundaries is hard.
And,
Mine feel like spaghetti. I love all these images.
Yeah, these are great visualizations. I love these.
Okay. And so regardless of whether or not you are a rock wall or a mist of marine layer, we know that it's so much easier to set boundaries and maintain them when things are black and white. Just like with this maze, we can see here where we enter into the maze and then where you exit. And then also with these walls in the maze, it's so much easier to see, okay, this is where I'm going. This is how I need to navigate.
It's just really clear, a lot of these.
Yeah, and as people were mentioning, it's easier to do with certain people
Right.
or in certain environments or roles when things are really clear. And we know that when things are not clear, when it's all just gray like this, that it's hard to find our way. I know sometimes when you're in a new situation or specific settings or environments or with people maybe who feel unsafe, maybe when you're feeling disempowered.
Yeah. For instance, if in the world of work, you have someone that has supervise someone with power over you, asking you to do something that isn't comfortable, that's gray. It can be very gray.
Yeah,
It can be
and
gray.
sometimes
Yeah.
you're forced to do it.
And you're forced to do it
Hmm.
sometimes. Yeah.
Hmm. And then the other thing that I think about around this gray is that sometimes we're the culprits.
Hmm.
We're the ones who can um, tend towards setting expectations that push you beyond your limits,
Hmm.
and in essence, you violate your own boundary. And I know, and I say this because this is something that I'm vulnerable to. I like to challenge myself. I like to push myself. I like to feel strong. And so oftentimes I can find myself doing so much more than I really want to. Um, and and to stop myself, even if I have those signs and symptoms, it's hard to be aware of them because it's such a habit. It feels so natural. Um, and it's something that I've practiced for a number of years because it's just, I know it's that important to me. And I know that there's a real cost to not doing that. Okay, so next, we'd like you to consider an unclear situation that you might have been in recently that was not in alignment with your values. And where you weren't quite sure if you wanted to set a boundary, if you would set a boundary. So think about that recent situation. And as you're thinking about this situation, think about what was your compass telling you? What was your immediate internal reaction? What direction was your compass pointing? What did it tell you about what you felt and what you wanted? And if there are any other signs or symptoms. And feel free to share with both of these through the
Sure.
chat as well, because
Yeah.
we'd love to hear from you. Right. So someone's sharing that some family members are racist and that they struggle with speaking up, which could cause an explosion or harboring the anger inside.
Mhm.
And so that's certainly a great um, example of an uncertain situation.
Mhm.
And then someone else is sharing more anger as a sign. And someone else is sharing that they're asked to do something that wasn't in alignment with their values, but was asked to do it, which felt like a sign of confidence from the person who was requesting it. So likely that was in alignment with another value.
Mhm.
Mhm. Or else another person sharing an internal reaction of defensiveness.
Yes.
Hmm. So there's this wanting to set up this boundary.
Mhm.
And then the last one here is if you're not sure, um, the situation is so unclear, you want to think about, did you want to move closer or did you want to move away from it? Because I think sometimes our signs are so subtle that it's hard to do anything more than just being aware that something's off,
Mhm.
right? And so that that test of approach or withdraw is a really helpful one to get some clarity in those unclear situations. And then someone else is sharing too that when they're talking with family members who are racist, that um, there's this kind of incongruence between like the roiling anger inside and then how they show up and try to talk very calmly with them so that it's an open conversation.
Mhm.
And then having to maybe withdraw because the other person isn't able to listen or receive anything that is from outside their view.
Right.
Mhm. Yeah. And so we
Yeah,
have
that's
to
very
make
true.
consider all those different components, where the other person is at. Okay. And so think about, and people have been sharing already,
Yeah.
if your response to this unclear situation that you had recently, if it was in alignment with your value, what value was supported? And what were some of the things that helped you to handle the situation in a way that felt positive to you and that you want to do more of in the future? And if your response was not in alignment with your values, now that you're thinking about it and having some space to process it, what would you have liked to have done differently?
And going back to one of the last comments, I think that that's great. That it sounds like you were making a conscious decision on whether you needed to withdraw or not. And at some point, you might, in some instances, you might choose based on your values that you can't withdraw and you need to say something.
Mhm.
But you would also know the consequences of that. And so it's all this awareness, stopping yourself long enough to have an
Mhm.
awareness of the choices that you're making in those moments, which takes so much practice. I mean,
Yeah.
it's so,
And I think too that, for me, it's finding a way to say what I want to in a way that honors me and honors the other person as well.
mhm.
Mhm. All right. And we know that no matter how good you are at being aware of your signs and symptoms and aligning with your values, we all have these unclear situations that take a little more attention and time to figure out what's best. And this simple practice of creating space to contemplate and really identify um, what you want can be really important.
Mhm. I always say, I think I said this maybe in the first part of the series, that if you feel like you've got this down, just go visit your family. And you probably have ample more ability to, or chances to practice.
Mhm. Yeah, and we have someone else who shared that, they like to check in with themselves sooner rather than later to
Yeah.
be able to take that time and space to gain clarity um, before responding and before, some imbalance really occurs
Well,
emotionally.
and in part why we like to start these sessions with just a centering breathing activity is it's if you know you're going to be in an environment. I
Mhm.
think family is a great example where your buttons might be pushed around
Mhm.
values and so forth. It's great to do those centering activities before you enter that environment.
Yeah. And so now we want to talk about asking for what you want, and we want to be able to sing it from the rooftops and think about what's the best way for you to make your requests. While we know that all of you have to be good communicators in order to do the work that you do, I know that it's easier to advocate for other people or to let things slide. because I'm the only one that's affected and maybe not other people. And I know I've done my fair share of talking myself out of setting boundaries because um, it was hard, or maybe I didn't think it was that important. And so I want to talk about how to make it easier on ourselves to do that. And the first thing you want to do is to make a statement. You know, even though we're talking about asking for what you want, being able to set that boundary, avoid asking a question, because you know what you want and you don't want to have to ask permission or wait for someone else to tell you it's okay, to be able to have that boundary set. Um,
And a question can be an actual question, or it can just be the inflection in your voice and how you pose something. So that's important as well.
yes, so the inflection of the rising at the end.
Exactly.
Is that okay if I do that? Yeah. And then you also want to be clear and concise in your requests, because sometimes when you're feeling uncomfortable about saying what you might try to soften your statement by providing a lot of explanation or giving a lot of reasons why you want what you want. And basically, by the time you get to the end of it, you know, we don't even know what you're asking for or talking about. And we can all get distracted. So you don't want what you're saying to get lost. And as I said before, you don't need to have a reason to want what you want.
No.
And less is more.
Less is more. Yep.
Mm-hmm. And then the next one is to take the time you need. I think a lot of times we're in this situation, and one person made the comment of needing to take that space. And I think being able to give yourself permission to think about it and say, well, I'm not sure what I want right now.
Mm-hmm.
Can I get back with you?
Mm-hmm.
Is very helpful, as long as you get back
Yes.
to it.
Or if you know in the moment you're feeling reactive, it's a good
Mm-hmm.
time to step back and take that time.
Take a breath.
Mm-hmm.
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 Yeah, because I think sometimes we might ask for the time and then be tempted to just let it go and not come around to it. We might procrastinate or avoid. So you definitely want to take the time you need and to set the boundary. And then the last one here is my favorite strategy to help clarify unclear situations. If you're uncertain which way to move, my thing is, if it's not a hell yeah, it's a hell no. So unless this is something, whatever the request is, or is something that you want to move towards, you feel such intensity towards it that you can't help yourself but do it.
Or it's just clear. It's consistent.
Yeah, it's clear, it's consistent.
Mm-hmm.
Don't do it.
Mm-hmm.
And
or take that time to reevaluate it.
Right, because you only want to move towards things that are important for you. And as we know, there isn't enough time in the day to spend your precious resources doing things that you feel ambivalent about. And so this is one of the things that I know for myself and for my clients that I work with, that it really helps to be clear. Somebody asks you something, if it's not a hell yeah, it's a hell no. And so I want to close this section with a reminder that, as always, you really want to be gentle with yourself. Start with the small things, situations that are low risk. You know, you
practice.
really can't get it wrong and you never get it done. This practice in living in alignment with your values and setting healthy boundaries is lifelong. And as you practice, you'll learn more about your preferences, what it feels like to live in alignment with your values, and to continually get better at asking for what you want. So I encourage all of you to really be playful with this. And we have someone who's sharing that one positive to the pandemic is, as a single parent, get to be a father I would otherwise not get to
Yeah,
be.
yeah, I've heard that a lot,
Hell yeah.
including hell yeah. Great. All right, so let's just turn to, I know we're coming in on the end. We just have a few more minutes, but we just wanted to share a few resources with you. Again, you can go to our Dimensions Work and Wellbeing Toolkit for Physicians, or there's another guide for addictions professionals. But we would say, again, don't get caught up in physicians, addictions professionals. The tools, techniques, recommendations within both of these toolkits really apply across professions, whether it's in the healthcare profession or other professions. And so that's at our website. So down at the bottom, and you can download these for free, disseminate them to your colleagues, whatever works for you. And then this is us. Well, actually, this is not us. These are a few more resources. So the Department of Psychiatry has put together on an ongoing basis, continually updating it, some great resources in the time of COVID-19. And then SAMHSA, we just want to say for those colleagues, or if you feel this way, you really need some help, whether it's immediate or just resources, there's the SAMHSA's National Helpline is really good. And we had one question: will you offer similar webinars in the near future? And we would love to. So we're just going to keep, or if you have ideas, feel free. This is our information. If you have ideas on topics that you really think that we should cover, email us, or any kind of feedback that you have. And we'll be sending out an evaluation on this. And so we would really love for you to fill that out, because that's where we learn about what was helpful, wasn't helpful, and really to continuously improve what we are doing as well.
Yeah, and thank you to you all for your active participation
Yeah,
and sharing.
that's what makes it work.
Yeah, this is really wonderful to create a sense of community.
Right. Thank you all. And thanks for taking a little break with us, and have a great rest of your day.
Take care.